have an interesting case, which is a cat that has presented with this mass over the left shoulder. The mass was aspirated and found to be a chondrosarcoma. We took chest radiographs which showed no evidence of secondary spread, and so we're doing a wide local excision, but not as wide as we would do if it were an injection site sarcoma. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. So just to review, this is a 12-year-old cat that has a chondrosarcoma over its shoulder, confirmed on aspirate. It's been growing for about the past month. The other differential diagnosis would be an injection site sarcoma. We talked to the owners. Can you give me some retraction there, just on the skin? Talked to the owners about getting a tissue biopsy rather than a fine needle aspirate to confirm one way or another whether it's an injection site sarcoma or a chondrosarcoma, but the owners refused and said they just wanted to go ahead and have surgery and assume that it's a chondrosarcoma, because in order to get a clean margin or get a wide excision that we would like with an injection site sarcoma, we'd have to basically do at least a total scapulectomy, if not amputate the leg. So I've gone 2 centimeter margins. Chondrosarcomas usually are not terribly invasive.
Would you like an oscillating saw set up?
Yes, please.
Could we at all get the oscillating saw?
And a guest surgeon scrubbed with us, Tesh from Melbourne Uni. I worked with Tesh a couple of years ago. She spent some time with me at Southpaws. It's nice to reconnect. All right, so I've got the spine of the scapula right here. That's the acromion is right there, and so I'm going to come pretty close to the glenoid.
It would be like trapezius.
Yeah.
Okay.
So cutting through trapezius right now.
Just going over the caudal, is that scapulospinal caudal margin?
That's caudal margin. Yeah.
Okay.
Alright. Just give me a little bit of retraction on the whole mass there, yeah. So that's acromion is down there, and that's acromion right there.
Okay. So you're going to go just proximal to that then?
Yeah.
So you'll save your suprascapular nerve?
Yep.
Yes, okay. Not that it really matters.
Yeah. Alright, so I've just gone through probably infraspinatus. And we'll retract on that cranially. Just grab a hold of that and I'd like not to take the cranial margin of the scapula if I can avoid it.
Why is that?
Just for function.
Okay.
And I'm just going to assume that trapezius and supraspinatus is going to act like my fascial plane. about that big, kind of a medium.
Length or width?
That's length. That's way too long. It's about that long and about that wide.
Oh, so tiny.
Yeah,
So your dorsal scapular margin there.
is there.
There, okay. Yeah, okay.
No, that's spinous process
Process,
there.
okay.
So that's dorsoscapular margin
Okay.
there.
Yeah, okay.
Yeah.
So just working through trapezius and rhomboid.
Yeah. How long is that one?
Not very long, it's like that long.
That'll probably, I think I'll take that one there.
This one?
Yep, yep. I'm cutting right through the infraspinatus down to the scapula. And that's the scapular spine right there. You know what I might be able to do is just take scapular spine and not scapula at all. I think that that'll be fine, yeah, because the infraspinatus and supraspinatus are going to act as my deep margin.
To take the muscles as a deep margin.
Yeah.
Yeah, that makes sense.
Yeah, just like that.
Yeah.
Um,
Maybe better for the cat.
all right, so
You want some kind of a cup on there. Would that be helpful?
let me just see how I go for a minute. Okay, so I've gone through the spine. Do we have any bone cutters? Like rib cutters?
Flush? You need flush right now?
We will need flesh
Probably
it.
rib cutters first.
Rib cutters first, yeah.
You're just down onto the scapula.
So that's
Yeah.
ventral, that's
Yeah.
medial to the scapula?
Yeah.
So is that, what is that, vastus lateralis
Yeah,
and teres
yeah.
major?
Yeah. And then sort of down there you're onto the bone.
Yep, so stick your finger in there and you can feel the bone down there.
Okay. Do you need elevator at all?
That one, I think I've got a Freer. No, I don't. And a periosteal elevator, please.
Yep.
All right, so I'm just going to come up underneath.
Will that be okay, the AO cup? Or
Yeah.
Yeah.
No, that'll be fine.
Awesome, thank you.
So I've cut through my scapular spine all the way up. Now I'm just cutting through the infraspinatus.
What suture material would you like?
I'll get some bupivacaine first.
Yeah. How many moles?
What's the dose for this cat?
2 mil.
Yeah. you. We'll dilute out that bupivacaine 50-50,
50-50, yeah.
just so we can get more volume.
What was the volume you wrote down?
2 mil.
2 mils, okay.
So I'm right down onto my cranial scapular spine right there. Okay, so now we've got a great deep margin, not even close to tumor there. And then our skin margin there, lots of muscle all around it, so I think we're in good shape.
Okay.
Yes, please, yeah. Thank you.
Okay.
Do you have a needle for me? Or
Oh, you can? Yep.
Cool, thanks. How much do you trust me?
Hi, P from Baton Rouge.
Upside down for us.
Glad you're inspired to be a surgeon. How far along are you in your career?
2
Um,
mils there.
All right, so these guys are usually quite sore after surgery, so we'll just have to make sure that we
Got a 3 mil syringe. Do you want me to dilute
just
with
fill
the
it,
3 mils?
yeah, yeah, as much as you can get in the syringe, yeah.
Maybe 3 and a bit.
Yeah, and then we'll just grab the needle.
Could we grab an orange leaf by any chance? Thanks.
And then with bupivacaine, you just want to make sure that you aspirate every time you inject because it's pretty toxic.
What do we give if we get a bupivacaine toxicity charge?
It's usually seizures, and so we would give diazepam
Remember there was another thing though that you give?
that you give for bupivacaine toxicity. That must be a Georgie thing.
Yeah, it's intralipids.
What?
Oh, intralipids, that's right, yeah. Can I please get some 3-OPDS? What else do they use intralipid for? Is that for diabetes or something? Or
I think it's opposite. 3-OPDS?
yes, please.
That. Can't remember the whole mechanism of
All right, so I'm just going to try to reattach some of this muscle here to periostrum. Just try to give it a bit of an anchor for mobility. Though this cat should have very limited, yes please, very limited negative effects from this surgery long term. Like its function should be basically back to normal.
It shouldn't even have too much of a post-op limp, hey?
No, you wouldn't think so.
Yeah.
So that's probably trapezius there.
Yeah.
I often think of surgical oncology being less skill and more just guts to take out whatever's in that circle, that margin.
like a oncologic surgeon, and then they've got the reconstructive surgeon that comes in and closes the hole.
Yeah, so that's what Tesh was just saying, is that they have two separate teams, particularly with maxillofacial stuff, where they have the resection team and the reconstruction team. The goal of the resection team is to cure the cancer no matter what. The goal of the reconstruction team is to try to make sense of what they've done and try to make a functional and cosmetically acceptable outcome. And so these two teams have diametrically opposed goals.
Yeah, it makes it quite challenging, right?
Yeah. I usually jokingly say that these two teams hate each other.
Yeah, you would think so. That
Yeah.
would make sense.
Another fascial plane here.
Yeah.
I'll try to bring down.
Another 30 PDS.
Yes, please. Such a treat having a surgeon scrub in with me, because you know to anticipate everything that I need. And I say good surgeons make good assistants.
Oh, we make the worst assistants, I think.
Trying to help too much, or?
I think sometimes you probably look at our surgical tables and you just look at the mess that we've made between the two of us.
Yeah,
Sort of sometimes feel like the nurse keeps us on the straight and narrow,
yeah.
keeps everything in its position.
I don't think this is going to be particularly structurally helpful.
Yeah.
Can't do anything with that. See, it's trying to suture through that cut surface of the muscle. It just really doesn't want to hold
Yeah.
anything.
Is that still the infraspinatus that you're sort of suturing it onto?
Yeah. It's funny, in America I used to do sometimes 4 injection site sarcomas in a day.
Wow. And why is that? Did they give rabies vaccinations?
Rabies
Okay.
vaccines, yeah, yeah. And I kind of really liked cutting them, and so
Yeah, they're quite fun.
yeah. So I made a little, kind of a name for myself that I liked them and I did well with them, and so I got a lot of referrals.
Yeah, okay.
Nice thing about cats is that they have 2 cats
So
worth of
much
skin.
Yeah, exactly.
So it'll probably,
Like a bit black and white, so
yeah, I think so. I think I'll come from
Yeah.
here. Up to here. And then to here. Am I about to lose that one?
I don't know if that's pulled through.
Is that? I thought I got a new piece of.
No, I think this is still the old one. Wait.
Good save. Might have you re-grab that for me. Yep. Yeah. Can I get another pack of 3-0, please? So I'll come down across the bottom if you want to go across the top. Or I can come down the bottom and you go across the top.
So the contiguous.
Yep. And just an intradermal, I think.
Yeah,
You know what I'm going to do here? Can I please have, hold up just a second. Can I please have a, like an 8 French feeding tube? I'm going to do like a wound soaker.
Yeah, okay. I think I'll just let
That's
that
fine, yeah.
slide there.
Can you tent that skin down for me? So I'm just going to put in a wound soaker catheter to provide pain relief after surgery. So a local anesthetic after surgery is just so much better than anything that you can give systemically. Yep. So what I'm going to do is I'm going to make some more fenestrations by just folding it and then cutting the corner off. Add a couple of extra little holes so that when we give our Marcaine, we'll get a little bit better distribution.
Do you ever get the dedicated wound soaker catheters?
I don't, can we get them here?
Yeah, you can do.
Okay.
Yeah.
I'm just going to,
This works quite well though.
going to put in my finger snare, otherwise I will inadvertently pull this out. Can you pass that to your other hand? Pass that guy to your other hand, and then back. And hold on just a second. Yep. 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 Thank you. Just tuck that in. Thank you. It's to inject bupivacaine after surgery. So every 6 hours we'll do a 2 ml bupivacaine diluted in 2 mils of saline. So for a total of 4 mils.
Until the patches are
I think we'll do it all night.
all night, yeah.
Yeah. Rather overdo it.
And I heard you say that they get quite sore.
These guys are quite sore, yeah. So we'll do the Fent CRI overnight and the wound soaker
Do you want the CRI to keep going?
through the night, yeah.
Through the night, yeah.
Charles, are you taking any like deep tacking baths?
No, I'm not.
Just intradermal?
Yeah, there just isn't much. I'm just kind of getting that connective tissue, and then we'll probably put in skins afterward.
Yeah, okay.
I talked to the owners about potentially chemotherapy, but if this is a chondrosarcoma, then chemotherapy is not indicated. Try not to get your suture.
Around you.
Two surgeons working in very close quarters.
Yeah.
Do we have like a stockinette or something, like a sock that we can put on? So I think that putting a little bit of pressure can also be helpful with pain.
Would you be worried about seroma formation in a case like this?
Not worried about it. I mean,
Yeah.
it might happen, but it's not
A concern, yeah.
a major concern.
Yeah.
And there's really nothing that we can tack down to there.
Yeah.
Suppose that you could do like a latissimus dorsi flap or something, but I think that that's,
Overkill.
yeah. Just not sure that it would provide really any benefit.
Yeah. And it probably also increases your tumor margin
Yeah,
or your excision margin.
exactly. And potentially more pain from the bigger incision that you'd have to make. So the difference between a chondrosarcoma and an injection site sarcoma is quite important because chondrosarcoma has only about a 20% metastatic rate. Injection site sarcoma can be as high as 40, usually we say about 25. Injection site sarcoma may be chemoresponsive as far as preventing or reducing the risk of metastasis, whereas chondrosarcoma would not be chemoresponsive. The margin that you need to get for a chondrosarcoma is a couple of centimeters, whereas with a injection site sarcoma, you're talking about 5 centimeter margin and 2 fascial planes deep. So we did recommend a pre-surgical biopsy and a CT scan, but the owner refused both.
Yeah, it's interesting. The wife sort of seemed pretty keen on it.
Yeah,
Husband very anti.
yeah, which is a bit strange.
Yeah. Would you ever use like an active drain in these cases to minimize the risk of seroma?
As in Jackson Pratt.
Yeah.
I just find that with an incision this small, even the 7 mil is just a lot of
Yeah.
silicone.
Huge, yeah.
Like I'd almost prefer to put a suction, somehow get a suction bulb on this little catheter.
Yeah. Sometimes we used to like MacGyver one out of like a 20 ml syringe.
Yep, yeah,
And that worked quite well.
with a needle across the,
Yeah, just
Plunger.
across the plunger,
yeah. So I would not be opposed to doing that.
Yeah, okay.
You happy to finish up the
Yeah, sure.
rest of that? All right, so I'll just come over and make sure that I haven't missed anything. Ilic, I am finishing up a partial scapulectomy, very minimal scapulectomy for a chondrosarcoma, which is right over the scapular spine in a cat. We've done 2 centimeter margins. Chest x-rays were clear beforehand. 2 centimeter margins, and then we've been able to close some of the muscle over the top. We've put in a wound soaker catheter, which is just a urinary catheter that we're going to inject bupivacaine into every 6 hours. Hi, Netherlands, San Diego, Brazil. So we'll go ahead and leave it at that. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. And we will see you again soon.